That's a really interesting question, actually. So you'll find that in the majority of clinical trials into psychedelics, it's very strict that participants come off SSRIs before a psychedelic is started. The majority of my research is into ayahuasca, so I'll mainly speak about that. There's been some concerns about combining psychedelics with SSRIs in terms of something called serotonin syndrome, which is basically increasing the amount of serotonin in the brain, which is the chemical that, very simply put it, regulates mood. And if you have too much of that, then you can have this potentially fatal condition called serotonin syndrome. So for retreats and for clinical trials alike, normally participants would have to come off at least 2 weeks before all of their medications, including SSRIs, to prevent the risk of this condition occurring. That being said, the jury's out for whether or not serotonin syndrome does occur as a result of psychedelics, specifically in relation to ayahuasca. So there are churches, syncretic churches, all across Brazil that utilize ayahuasca in combination with Christianity. And for most people who attend those churches, if they are on SSRIs, they don't normally stop taking their SSRI. Or if they do, maybe they stop it a day before, they don't have this washout period, or maybe they even keep taking it when they're drinking ayahuasca. And there hasn't been, as far as I'm aware to this date, there hasn't been any deaths that have been reported as a result of serotonin syndrome. The symptoms of serotonin syndrome as well are also remarkably similar to the symptoms of an ayahuasca experience. So there's some confusion, sweating, maybe some abnormal movements. So for many people, they think that serotonin syndrome is a spectrum, and maybe some of the symptoms that overlap with an ayahuasca experience might not actually be as fatal or as dangerous as it seems. So the jury's out. I mean, I do want to also say kind of my medical opinion is that better safe than sorry. If you are going to take a psychedelic, it's best to stop anything that could result in something like serotonin syndrome at least 2 weeks before in order to flush it out of your system. But it's not quite as clear cut as it might seem.
Yeah, I really echo a lot of the things that Simon said. It's very much in our studies and in our clinical immersions, we do ask the participants come off them, but obviously SSRIs have been prescribed for a reason, and it's not always a pleasant thought to go off of something that somebody's been on for years. So we do encourage it. We do encourage a medical opinion as far as how they should titrate off. But it is interesting. You do see that the SSRIs, which basically block the reuptake, so you end up with more in the brain. They can be there's basically there's an antagonist that you can take that would actually kind of assist you. It's risperidone, and so that can assist if there is such an issue that Simon was referring to. But at this point, we certainly err on the side of caution and say that it's best for those who do want to experience a psychedelic experience, micro or macro, to titrate off of their SSRIs prior to ensure that they really do have a full effect. Much more research needed, and I think the titration is going to be a very interesting one where we can monitor hopefully their serotonin levels and actually be able to titrate off of, let's say, an SSRI and onto one of the psychedelic compounds, let's say perhaps a microdose of psilocybin, so that they don't have that cliff, that cold turkey, so to speak, effect.
I think that's a really good point that Nick makes as well. You can't just stop these medications abruptly. There are some occasions where you can swap from one medication to another one if it's acting on the same receptor. So, for example, an SSRI onto another SSRI. It's a really interesting idea that Nick's talking about here of going from an SSRI to a psychedelic. That's something I haven't come across before, but it's certainly interesting and begs more research. So what is needed is to gradually reduce the amount of the medication you're taking to avoid these really horrible side effects, actually, that you can get from SSRI withdrawal.